Thank you for coming to talk about your father.
We don't know much about strokes at all.
Could you explain a bit about it?
Sure. A stroke is a type of brain attack. There are two main types of strokes, but the most common type is the ischemic stroke, where the blood supply to the brain is blocked.
Did our father have that type of stroke?
No. Your father had a sort of mini stroke. It's a warning.
So he could still have a stroke.
Yes, he could. This is why I want to explain to you both how to recognize the symptoms of stroke. That way, you can get your father to hospital quickly if he has a stroke.
Okay, what are the symptoms of stroke?
You can use an acronym called F.A.S.T. to remind you of the symptoms of stroke. F.A.S.T. stands for face, arm, speech, time.
Face, arm, and what are the other things?
It helps you remember the three main symptoms of stroke. F stands for facial weakness. A person who has had a stroke finds it difficult to smile, and sometimes their mouth and eye droop on one side.
Yes, I think I have noticed those signs before. What about the letter A? What does that stand for?
The letter A stands for arm weakness. You need to ask your father if he can raise both arms. Notice if he can't raise one of his arms.
I see. I guess it would be the same side as the facial weakness. And the letter S, what does it stand for?
The letter S stands for speech problems. Check that your father can speak clearly and understands what you are saying. Also, notice if he is slurring his words.
So, watch to see if his face changes. See if he can use both arms. Finally, check to see that he can speak properly. What about the last letter, T?
This is the most important one. T stands for time to call the emergency number. It's important that your father gets emergency treatment as soon as possible if he is having a stroke.
Yes. We understand. If we notice all those changes, we need to get our father to hospital.
That's right.